A strong economy relies on equity and opportunity. Professor Angie Fertig's work explores social welfare policy and economic analysis. Professor Fertig, how does your work here at the Humphrey School pull in these themes?
I'm a health economist, so I spend a lot of time thinking about health disparities. I study health disparities with respect to income, and so there's very strong literature that has found that if you are low income, your health is worse than if you had higher income, and your life expectancy is worse. And there have been studies. The last one I saw was from the National Institutes of Health just a few years ago, found that the cost of health disparities is on the order of $450 billion annually in the United States.
Okay, let's stop just for a sec. So the National Institutes of Health found that the cost of poor health in our society as a result of health disparities is $450 billion.
Yes, it's a very large number.
Yeah, and big impacts.
Yes, and it comes not just from medical expenses, which is what most people think, but it's from lost worker productivity. So if you are living a little bit less than you should be, ideally, and if you are less healthy, then you're not working as much and contributing to our economy as much as you normally would. And so that's where a lot of the costs come from. And so when we have a strong social safety net in the United States, that reduces those costs. And so,
Okay, a safety net.
yes,
What is a safety net?
a safety net is where your people who are doing the worst in your economy, where you just kind of have some protections for them so that things don't get so bad for them. And we're doing that, because we care about people, but also because it's good for our economy. That if you can make sure that people are able to eat even if they lose their job, if they are able to keep their home even if they are having a rough time right now, that those things matter quite a lot for keeping them in their job, making sure that they can recover from this bad spell, and helping our economy keep moving.
Yes, this strengthens our economic prosperity overall and for the individual and their family.
Yeah.
I know you've done some studies in this area around SNAP and eating. Tell us about that.
Yes, so I've been working a lot in the area of food insecurity, and SNAP is the main program in the United States focusing on reducing food insecurity. So
Supplemental
Nutrition Assistance Program is
Awesome.
formally called food stamps, and so most people know of this program. I did a study with researchers at the state of Minnesota where we combined data from both the SNAP program that's administered at the state level and the Medicaid program. And so usually those data systems don't talk to each other, they're separated. But in this case, for this study, we were able to put the data together, and we found that there's a group of people in SNAP, according to the rules, that they are not allowed to have SNAP for more than 3 years or more than 3 months out of every 3 years. And so these people are called ABODs, able-bodied adults without dependents. And so these people are expected to work or go to school or something if they want to continue to receive benefits past 3 months. And what we found when we connected it to Medicaid is that most of these people were not capable of work. They had diagnoses that were very serious and just not able to have work. Their health conditions were invisible. They were mostly severe mental illness. And so we, the person who's signing somebody up for SNAP and saying that they have to have work requirements is a social worker who is not a medical professional, not someone who can diagnose somebody and decide whether they work, and yet they're forced to do that. And as a result, these people are pushed off of having SNAP benefits, which can be devastating.
Your research is fascinating. It really ties together topics of healthy eating and work and economic prosperity, not just for the individual, but the ripple effect to the community and communities that individual touches.
Yeah.
Thank you for your research and the impacts on our society.
Thank you.